Excellent. How are you today, Shannon?
Good.
Yeah, thanks for coming in.
No problem.
Did you drop your children off
Yes.
school and
Yep.
daycare?
Yep. That's all been done.
Great. Yeah. And did you get lots of sleep last night?
No. No, Fletcher's been having a few bad nights in the
Has
last
he?
3 or 4 nights, yeah.
Ah,
We're still testing foods at the moment, so we
right.
tend to have reactions quite often.
Yeah. Ah, okay. Well, we'll sort of talk about that in a little bit.
Yep.
I'll just explain a little bit about what we're going to do today. So, as a naturopath and herbalist, I use natural methods of healing, and so our consultation will take about 90 minutes today. We'll look at the underlying factors contributing to your health issues, and that'll be from information you've given me already and from questions that I'll ask. So I'll look at the body systems and see what's going on there. Also, we'll do some physical assessments that are relevant to what's going on for you. So we'll look at that as well. And then I'll evaluate what's causing your health issues and make some simple recommendations today. And then on Friday, I'll give you the treatment plan. Okay, so we'll follow up in about 2 weeks' time. And so we'll see how things go then. So what I'll do is I'll just go through your client registration form that you've completed.
Yeah.
So thanks for doing that. So you're currently breastfeeding, aren't you?
Yes.
Yeah. So, and how often are you breastfeeding at the moment?
Within a 24-hour period, probably 10 times, I'd
Yep.
say. It's quite hard to say because
Yeah,
it's sort of on
so-
demand, so.
Yeah. Great. And are you taking solids as well at the moment? or-
Yes. He tends to eat a lot better when he's feeling better with his reflux.
Right.
But when he's not, he shuns solid food and just wants to breastfeed all the time.
Yeah. Okay. So with Fletcher, isn't it? With his reflux, you're trying to work out which foods are not working well for him.
Yes, there's been a couple that we've known since he was really little.
Yeah.
And then there's been some that we've been testing over the last 6 months because from about 6 months of age onwards he got worse and worse rather than getting better. So we've been trying to figure out what's causing the problem.
Yeah. And so what foods are a problem for him?
At the moment, I'm not eating egg, almonds and dairy. He's also not having potato, banana and apple.
And have you found that those foods, potato, banana and apple, have made a difference for him?
Yeah, well,
Yeah.
I think we tested them as we introduced them, so he wasn't having a lot of them beforehand.
Yeah.
But they were just ones that we picked up when he started eating solid foods. It was more the dairy, the egg and the almonds that made a difference overall to how bad he was.
Okay.
Yeah.
Okay. All right. And so I'm just going through here. So what did you do before you had children from a work point of view?
Right back to before my first baby.
Yeah.
I was in hospitality
Yeah.
for a long time, and then when I got pregnant, around the time I got pregnant with my first boy Jack, I changed to retail, so I've been a retail manager since then.
Okay. Great.
Not a lot in the last 5 years though. With Jack I stayed home for 3.5 years, and then I only went back to work for a year before I left again.
Right. Okay. Great. And so tell me about, so you've got extreme fatigue, and that's affecting your cognitive function. So tell me about what's happening there.
Well, I think for a while a lot of it was just the sleep deprivation.
Yeah.
But then when I went through a period of having some better nights and still having so much lethargy during the day, that it started to feel like it was more than just the sleep.
Yeah.
And I think sometimes my brain function is a bit scary. Like there have been times when I've been driving and felt like I literally cannot keep up with what's going on around me. Or even listening to a conversation on the radio and not being able to keep up with what they're talking about because I just can't process it fast enough.
Yeah.
Short-term memory is really bad, and I've had conversations where I just get stuck in the middle and can't think of words or string sentences together. Or my husband picked up that I was saying I don't notice it as much because I'm thinking the right words, but I'm not saying what I'm thinking about, like just names of things.
So do you
it's not
hesitate
all
when that
connected
happens? Or?
No, I don't even notice
Don't
it.
notice it,
Yeah, because I'll be thinking about the right thing. It just comes out wrong.
Okay.
Yeah.
Yeah. Okay. 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 And so that makes it make it difficult for just generally, does it?
Yes.
Everyday
Well,
life.
the memory and brain function is making it quite hard for my study.
Yeah.
But the fatigue is really impacting on my everyday life. Not being able to, or feeling like it's really, really hard to just do normal everyday tasks, especially looking after wee children.
And so your fatigue, I think here you've said, like energy-wise, it's between 0 and 3 out of 10.
Yeah, it's really
Yeah. So does that vary during the day, like generally, or some days worse than others?
Some days are worse than others.
Yeah.
And it varies during the day.
Okay. Yeah. Okay. And so would it be 0 like at some time every day, or does that vary? Not necessarily.
No, maybe not every day.
Yeah.
Yeah.
Okay. Yeah. Okay.
I don't think it would. I think at some point every day I'd be, in that 0 to 3.
Yeah.
Range,
And
but
that
not
level.
necessarily all the way down to 0.
Yeah. And so does it get higher than 3 at other times?
I think I mentioned in there that I started taking the Max B.
Yeah. Yeah.
And after about a week of initially taking that, I started to feel a difference. But it seems to have gone down again since then. Even though I'm still taking it.
Yeah.
But I think during that time I was having some better periods of being above 3.
Yeah,
But at the
okay.
moment, probably not.
Yeah. Okay. How long have you been taking the Max B?
Maybe a month.
Okay, great. And you're taking 1 ml a day?
Yes. Well, that's what it says on the directions, but the friend who recommended it and ordered it for me, she said that I could increase from that, but I thought I'd wait and see how what you recommended. So I'm still just taking the 1 ml at the moment.
Yeah, okay, great. And you're taking the zinc tablet as well?
Yes.
Nature Sunshine. Have you been taking that about the same time?
I may have started that before.
Yeah.
I've had that sitting there for a while and have probably taken it on and off for a while. But when I started to notice that things went right, I did start taking that again.
Okay. Did you notice any difference with that at all?
I can't remember.
Yeah, no, that's all right. That's fine. Okay. So and so today you wanted to look at improving, helping your energy levels, improving your energy levels, and helping your concentration and memory.
Yeah.
Yeah. Okay. Great. We'll look at that. And so, did you have a consultation with your friend or?
No. We have just like a little Facebook group for the girls that were in our first year workshop together, and we just talk about things all the time, and I just put it out to them then, and she just suggested it and
makes
brought it up for me.
Good
Yeah.
product, so, yeah, that's good. Okay, so I'll just look at, so with the illnesses that you've had, so when were these happening? So with the depression, was that following you had postnatal depression? Was that after you?
So I've had clinical depression and postnatal depression.
Yeah.
And clinical depression was maybe from about 20. I think I was on medication for about 4 years. I came off it during my first pregnancy.
Right.
And I was okay for a while after that.
Yeah.
For a long while. And the postnatal depression was earlier this year, but I've been doing better for the last maybe month and a half, so I feel like I've kind of gone past it.
That's great. And so, so you mentioned that you've taken
the Vena vaccine.
vaccine.
Or it's called Effexor, the brand name.
Yeah, okay. So you came off that prior to your first?
It was during pregnancy. I went
yeah.
off it, yeah.
Okay, great. And so the mild endometriosis, when was that?
Maybe current. The doctors have just
Okay.
said, well, they suspect. There's a strong history in my family, and I always had trouble with my cycles, and they've said it's not worth checking out properly. And when I was a teenager, they just prescribed the OCP to manage it.
Right. Okay. So did they suspect the endometriosis when you were a teenager, or just?
I think at the time they said maybe, but one doctor in particular said he thought it was, remember his words being an overproduction of hormones, he didn't say what.
Yeah.
And then later on, I've had another doctor say that he suspected it, and then when I had a miscarriage a couple of years ago, they said it's most likely there's a mild case.
Great.
Yeah.
Okay. Thanks for that. And so the surgeries that you've had, so that was just 2 years ago with the miscarriage.
There was no surgery there.
No. Okay. Yeah. Okay. So you used there was a medication that was used to induce labour.
Yeah.
So that's great. There was no surgery. And the septicemia in your foot, when was that?
Maybe about 7 or 8 years ago.
And what that was resolved fairly quickly, was it? Or?
Yes, it was a blister.
Oh.
And I was walking around with it because it was a blister.
Yeah.
And then it got to the point where I couldn't walk on my foot, and I went to the hospital. My husband thought I was being silly. And yeah, they rushed me into X-ray to make sure it hadn't got into the bone, and straight onto IV antibiotics because they said it was quite severe and very close to getting into the bone and having to cut out part of my foot.
Wow.
But I think we just put it off because it was just a blister, literally just
Yeah.
a blister that had got infected.
Well, it's great that you went to the hospital when you did. So you had the IV antibiotics, and then did you have antibiotics after that, or when you got home? Or?
I can't remember.
Sure.
Sorry.
Yeah.
Yeah.
Okay. Great. And so you mentioned with under medications the antibiotic courses with the last one 12 months ago. How many times have you had antibiotics? Do you know, just roughly?
To be honest, I don't, because I didn't think anything of it growing up. It seemed quite a normal thing for me. So I never really took much notice. With the miscarriage, I got an infection, so there was a course then.
And the your septicemia. Yeah, okay, that's great. So,
I would say at least 5, maybe
okay.
more.
And so growing up, was there any particular problems that you had regularly that you had antibiotics for, or just
No.
occasional?
Okay. Yeah, I don't remember having to have them regularly.
Yeah. Okay, that's good. Okay. And so sleeping obviously varies depending on what's happening with your children. And so you get about 5 hours a night on average?
Yeah, I would say on average.
Yeah.
Sometimes it can be a little bit more, but there are, nights that it can be a lot less.
Yeah, okay. See, one time during your food diary it was 3 hours.
Yeah, and actually for the last 3 nights I've had about 3 hours.
Yeah, okay.
So, walking dead today.
You're doing well. And so, how many times would you get up during the night?
I don't get up anymore, I just sleep with him.
Okay.
But often he's either stirring and on and off the breast for hours.
Yeah.
Or he's just on and I can't get him off. That's when he's really refluxy because he just wants to continually suck.
Yeah. Okay. And so do you sort of, I guess it's just unsettled sleep, is it, for you during the night?
No, often I'm awake for hours.
Okay.
Like this morning, I was up from, well, not up out of bed, but I was awake from 2 till 5. Some of that time he was awake and some of the time he was dozing while I was trying to get him back to sleep.
Right. And then do you find it hard to get back to sleep yourself?
Sometimes.
Yeah.
I've forced myself to stay awake for a period of time.
Yeah. You had your slip disc in March.
Yes.
How did that happen?
Well, I'm not sure if I wrote down there. I was trying to remember things to write, and I actually had SIJ problems during both pregnancies, but especially last pregnancy, and I was on crutches for a little while.
Right.
And so I think by the time March rolled around, I was still quite weak, and literally all I did was bend over in the shower to shake my legs, and couldn't stand back up.
Wow.
So I was pretty debilitated for a couple of weeks.
Yeah, that's no good.
And still now not great. Yeah.
Yeah. So so use the tramadol then to help with pain.
Probably just for a couple of days, and then after that I just managed with Panadol.
So how long did you use the Panadol for?
Maybe a week.
Yeah, okay. Right. And so you're still getting discomfort from it, are you, or what's?
Yes. I still don't think I'm very strong in that area. So if I'm using my back and my core too much. Like sometimes Fletcher needs a lot of carrying,
Yeah.
and yeah, if that happens, then, or if I'm being physical in some other way, then later on when I'm just doing something ordinary, it sometimes twinges.
Yeah.
It's just a reminder to
Yeah.
take it easy and do my exercises.
That's right. And so, you've started doing that, going to the gym and doing some sort of cardio and strengthening.
I tried.
Yeah.
I've kind of run out of time a little bit at the moment.
Okay.
Yeah, I probably had a couple of weeks of going maybe 3 times a week, but
Yeah.
I'm not sure if I'll be able to keep it up time-wise right now.
Yeah. Okay. So, are you doing anything to strengthen your core at the moment?
Yeah, I'm just doing like a few little exercises that the physio gave me,
Great.
and I try and do them on a regular, everyday basis, but sometimes it's just a couple of times a week.
Yeah. And that's helping.
Yeah, I notice a difference with it.
Good.
Yeah.
That's good. Okay, so downtime is sort of not studying and watching TV without kids. That'd be relaxing.
Yeah, the weekend doesn't make very fun.
Yeah.
It's just it's usually when I get kids down and I'm just too tired or my brain's not there to get any work done. So to chill out before I go to bed.
Yeah. And so your stress levels obviously fairly high.
Yes.
So,
Yeah.
yeah.
I think I've had like anxiety issues for a while, so I kind of always feel like even when I'm doing something that's quite relaxing, I kind of feel physically a little bit stressed anyway.
Yeah.
But I think lifestyle wise, my stress is pretty through the roof at the moment.
Yeah. So when you say you feel physically stressed, is that like a tension, or is it, how do you feel?
I think there is tension there. Like if I try and relax, I probably notice, and sometimes I get a sore jaw from clenching.
Yeah.
And that's when I know that I've been too stressed.
Yeah.
But I find it hard to explain. It's like everything's moving underneath the skin.
Okay.
Like
Yeah.
really agitated.
Yeah.
I feel it now.
Right.
Yeah.
Yeah.
Just a little bit.
Okay.
I don't know how to explain it properly.
Yeah. No, I know what you mean.
Agitation is probably the best word.
Yeah. I think maybe low in magnesium, like those are signs that magnesium is low, so it may be just as simple as actually, I mean obviously the stress that won't go away,
Yeah.
but it may be as simple as actually taking magnesium to help build your levels up,
Yeah.
so, and that will help you cope better. So we'll look at some other things, see if there's
Okay.
any other signs of that. So you've got supportive, your husband's really supportive.
Yeah, I think I'm pretty lucky because he's very
That's
hands-on and pretty understanding of how things are.
That's
sometimes.
really good. And you've got in-laws next door which help when they can, when they're asked to, so that's
Yeah, not so much when they can, but more when we
good.
say we really need it. Yeah.
Yeah, okay. Great, and so you're doing some things to other things with your children and without as much as you can. Which is
Yeah,
good.
probably don't do a lot without.
Okay.
We do try and spend time together as a family on the weekends.
Yeah.
When we can.
Okay. Have you ever smoked?
No.
You said none, but I assumed that you hadn't, but I thought I'd just check. Okay, great. Oh, and you mentioned here that like a traumatic, under the life-changing events, your traumatic first birth.
Yes.
What happened there?
He was premature. and we were flown from Wellington to Palmerston North in labour. I had a midwife who had me pushing when I was only 3 centimetres for about an hour and a half before she realised. And then he got stuck, and we had a really rough forceps delivery with her feet up on the bed,
Right.
yanking him out.
Mm.
And then I wasn't allowed to see him for about 3 hours because I'd been transferred from another hospital, and they wanted to make sure that I hadn't, brought any infections or anything with me.
Yeah, that would be hard.
Yeah, and we didn't have anything with us. We were, stuck in Palmerston North for 2 weeks, and because we hadn't expected to A, be going into labour, and B, be leaving Wellington, because that's where we were living at the time. We had to stay in a hotel over the road from the hospital, and we had no belongings. And
Gosh, that was traumatic.
yeah, it was a rough time.
How many weeks premature were you?
6.
Yeah. And so your second birth was at home.
Yes.
You said healing second birth. What do you mean by the healing?
Emotionally, I guess.
Okay, great.
Yeah.
That's good.
Yeah, it was a pretty powerful experience.
Fantastic. So you've actually obviously aware of the environmental stressors, which is great. So about 80% of your household and personal products are all naturals.
Yeah,
that's
I
good.
try and make a lot myself, but otherwise we try and buy non-toxic stuff.
Great, that's good. And do you use fresh produce, non-organic mostly? Is that right?
We can't manage what to find.
Yeah, that's fine. So, and just looking at your food and symptom diary, you're eating well much of the time, which is really good.
I think that in general my diet is good. It's more that I'm an emotional eater, and when I get stressed and tired, I snack and eat sweet stuff.
Yeah, and the dark chocolate's not too bad to have, but you're having quite
Well,
a
if I could have milk, it probably wouldn't be dark chocolate.
No, true. Dark chocolate's
It's not worth having milk
you.
chocolate at the moment. It makes the situation worse.
Yeah.
But yes, it is better.
Yeah, just from an observation, you may not be having quite enough protein. So if you had protein more during the day, and also some good fats during the day, then the energy will stay a bit higher. So we'll look at that anyway.
Okay.
But yeah, overall, you're eating some really good things.
I don't really have a lot of time during the day for preparing things.
Yeah.
So that's probably where I struggled with things like protein and
Yeah.
need things that are going to be sneaky. Just because a lot of the time when Fletcher's at home, he doesn't like me putting him down or leaving the room or anything.
Yeah. Okay. Great. So you need things that are easy to.
Things I can grab.
Yeah. That's understandable. How much water are you drinking during the day?
Maybe about 2 litres.
Yeah. So you do that most days?
Yeah.
Great. And do you have any other drinks? I see you like you're having a coffee.
Yeah, I don't
Once a day?
really have coffee now because I can't have the milk, but sometimes when I'm desperate I might attempt to have it black, but I don't really enjoy it, so most days I don't have coffee anymore. Other drinks? Not really, unless you could count smoothies, but they're more food to me.
Yeah. Okay.
No.
Great. And so I see a couple of the coffees that you had were with hazelnut milk. Is that actually milk made from hazelnuts? Is that what it was? Or I'm not
Yeah.
sure. Yeah.
And that isn't a regular thing. That was
Right.
something I was trying just because I saw it at the
Yeah.
health food shop and
Yeah.
thought I'd give it a go, but I don't really like it that much. So.
Okay. Doesn't do much for the coffee.
I was trying to find a good alternative, but there is none.
Okay. And so just with your eliminations, you've got you've got some good detail here. So when odour, you haven't mentioned odour, is there any unusual odour with your bowel motions?
No, not, I wouldn't say unusual.
Okay, great. And with your urination, what colour is your
Probably varies through the day. Like in the morning, it's usually darker, obviously, because I haven't had as much water.
So when you say darker, is it like a dark yellow or is it a browny colour or?
I don't know. I'm not really sure.
Not sure, that's right. Have a look,
Yeah, sure.
and let me know. Not sure. Yeah, some sort of things that you tend not to notice.
No.
And so it gets lighter during the day.
Yeah, definitely.
So would it be like quite a light yellow? Can it be clear sometimes?
Probably midday. I'd say towards the end of the day it gets pretty clear. Like afternoon, evening.
Okay, thanks. And so the sweating would be just when you're
Only with
exercising?
exercise,
Yeah.
yeah.
So in terms, I'll just ask you a little bit more about what you're eating and how you're preparing it. So how do you normally prepare your food? Like you've got the smoothies, of course, and like cooking at home. What
Depends what it is. Like we often have, chips with dinner, creamer chips, or sometimes potato.
So
it would
they
be
fried? Or?
yeah. Oh yeah, were baked and
Okay.
grilled in the oven.
Yeah.
Um,
And vegetables, would they be?
Sometimes raw, sometimes steamed,
Yeah.
sometimes baked.
And if you're having like your salmon or steaks or whatever, how do you do those?
So steak would pan grill. Salmon we usually bake every now and then. We'll fry it on the pan, but
Yeah.
most often it's just easier to bake it.
Right. And so do you use any organic foods at all? Or?
I mean, not really, not on a regular basis. I think the peanut butter we buy is an organic one, but only because it's at the supermarket and I like it better.
Easy to get.
And it's doesn't have anything else in it, which is what I like about it.
Good.
Because we try and eat whole foods as much as possible. So,
Good.
but other than that, no, I don't think anything's organic.
No, that's fine. And do you, is most of your food home?
Sorry, some of our fruit is grown at home. We've got oranges, lemons, mandarins, spinach, and some herbs.
Yeah, excellent.
So that stuff's all organic.
Yeah, great. That's good. And do you make most of your food like from scratch?
Yes. I mean, there's things like coconut milk and that which we get out of the packet. I've made sometimes tinned tomatoes. But meals and things, everything's made
From scratch, yeah, great.
You don't really buy packet stuff.
Yeah, and do you use any packet sauces or just
No.
Great. And are you aware of additives in foods? Yeah, good. And so, dietary considerations, you would avoid foods that Fletcher can't eat.
Yes.
Yeah. Anything else? Do you avoid anything else?
I don't eat bread or many other grains. Yeah, but I think if you just think whole foods, like
Yeah.
basically, I think they would say most of it, in grains, I don't think, other than sometimes rice, but otherwise not very often.
Okay.
Yeah.
Okay, great. And do you eat out very often?
Not really.
So on average, once a week, once a month, once a fortnight?
Maybe once a month.
Once a month, yeah. Great. And cravings would be chocolate, sweet food. Is it mainly chocolate or?
Chocolate and ice cream's usually my downfall, but I
Right.
can't have ice cream and I'm really so sad
No.
about chocolate.
Yeah. And do you crave any salty foods at all or?
Not really.
No, okay, so it's just looking for sweet. Great. Do you ever skip meals?
A lot. I just eat when I can.
Yeah.
I always have dinner, because usually it's, either with the kids or once they're in bed.
Mm.
And my husband's home at that time, so he often helps with the cooking. And I almost always have a smoothie at breakfast time, but again, he often just makes that for me.
Yeah.
But in between, I probably don't sit down and have a proper lunch very often.
Just too
I
busy.
just snack.
Okay. So what if you didn't eat or snack? How would you feel?
If I stopped eating,
No, sorry. Put that in a different way. If you missed a snack or missed a meal, how would you feel?
I guess low blood sugar, feeling faint and
Yeah.
more agitated,
Right. Yep. Okay.
headaches sometimes.
Yeah. Okay. That's what I suspected, but I just
Okay.
checked it.
Yeah.
Just make a note here. Okay, so now we'll get onto the body system section. Your digestive system, how's that?
In what way?
Do you have any problems at all? Any bloating or wind or anything like that happening?
I don't think there's anything abnormal.
Okay. Yeah. Yeah, I mean there's no signs that I can see that may indicate.
I mean, I get bloated around, the start of my period and that, but.
Is that a fluid bloating? Or do you get gas bloating?
Both.
Okay.
Yeah.
So normally would you, on a sort of everyday basis, would you have any gas?
Not a lot.
Not a lot.
No.
It's just occasional maybe. Or
Yeah, I wouldn't say, yeah.
Yeah. And your bowel motions look to be reasonable.
Yeah, pretty regular.
A little bit loose occasionally, is that?
Yeah, I think mostly it's around here.
Yeah.
Yeah.
Okay.
I don't know. It might have been something in particular that day.
Yeah, because that's when it was dark, so there was, darker,
Yeah.
so something obviously contributed to that. Okay, excellent. And do you have any skin issues at all, or have you had any skin issues?
I get skin tags.
Yeah.
And I sometimes get this flare of like a rash around the tops of my thighs. I'm still trying to work out what it's in relation to.
Is it on the outer side?
Yes, yeah, around, I guess the sides and the back.
Okay. How often does it happen?
Maybe once a month.
Do you use anything on it?
No.
Okay. What does it look like? Is it?
A little bit like dry skin to begin with, but it can sometimes get a little bit blistery in the middle.
Okay.
And just like in spots around the place, and it's itchy.
Yeah. Okay. How long does it last for?
A few days, maybe a week.
And then does it just go away on its own?
Yeah.
Okay.
I've wondered whether it's related to my cycle, but I'm still working on figuring that out.
Okay.
Or because we've been testing dairy over the last couple of months, or whether it's a reaction to dairy myself, because I noticed it at a time that I was on dairy and at a time that I had my period. So
Okay. Yep. At least you're observing what's
I'll see
happening.
next
So yeah. And so have you had a problem with dairy before? Like as a young child, did you get any rashes?
no,
or?
but well, not that we even knew of, but in the last maybe 8 or so years, I've always found that I've been quite congested in my nose, and had wondered whether it was a little intolerance,
Okay.
but I never bothered doing anything about it.
Yeah, it's only in the last 8 years you've noticed that. So
Yeah, I would say more since I left home and was out on my own.
Yeah. Okay. Is your skin dry generally, or?
I don't think so. Well, maybe a little bit sometimes.
So your legs, do you notice any dryness in your legs? Or?
My legs get really itchy. Yes, I think you're saying. It's just become so normal for me now. So my legs do get dry and itchy, and they end up scabbing.
Okay.
And that's only been happening for maybe within the last 5 years, definitely since Jake was born.
Yeah.
Yeah. I don't remember it happening before that.
Okay. And so the scabbing's been happening for that long, and what, the itchiness as well?
I'm not sure whether the scabbing is a result of me scratching or not. Yeah.
So what does scabbing look like?
If I could pull on my jeans, I'd show you, because I probably have a few little.
Are they just like small? What size are they?
Well, maybe if we go up on the size of my nail, maybe kind of,
Okay.
so
So about half a
yeah,
centimetre.
some of them
in
get a bit
diameter.
bigger than others.
Yeah. Great. And have your legs generally been dry, apart from?
I think they are.
Yeah.
It's a bit hard to say because in winter, I'm wearing pants and I don't notice so much, and then in summer I use a moisturiser. So.
Right.
But I always have.
If you didn't in summer.
Well, yeah, they'd be dry.
Yeah. Yeah. Okay. Thanks. That's good. And so, apart from the congested nose, like from a respiratory point of view, have you had any respiratory issues any time during your life?
I don't think so. Not myself.
No. So you didn't get asthma or had
No,
any bronchitis?
everyone
or
in my
anything?
family has asthma,
Yeah.
but I don't.
Right. That's good.
Yeah, I don't know why there was the odd one out there. I had, I've had some chest infections over the years, and I had one last year during pregnancy, which is when I was on the antibiotics. That was quite a bad one. I couldn't breathe very well. I had pneumonia when I was a baby.
Okay. Yeah, great. So, I don't know, great that you had pneumonia, baby, but great that you remember that.
Well, obviously I don't remember, but my mum told me at some point.
Yeah. And so, the chest infections, you said you had a few over the years, or some over the years.
Yeah, I don't really remember a lot.
Okay. But you had
Sorry, my memory after children is very vague.
Yeah, that's okay. But you have had more than the one that you had
Yes.
last year.
Yeah.
Have you had any urinary problems?
Yes, I had a period of about 3 years where I had an issue like getting UTIs again and again and again, to the point where my doctor just gave me like a container of antibiotics and just said, when you feel one coming on, just take these, so that I didn't have to keep going back.
Yeah.
And one led to a bladder infection.
Right. Like bladder or kidney? Because UTIs are like urinary tract infections.
Maybe it was a kidney.
Okay. So
I remember it
possibly-
being bad.
Okay. So you would have had quite a number of antibiotics over that time, presumably? Yeah. Okay.
Kind of forget about these things until I'm that.
That's why we do this.
Yeah.
Mhm.
Other than that, I don't think so.
Right, okay, thanks. And so how long ago was it that you, like when you said a period of 3 years, how long ago was that? Just roughly.
I'm just remembering where I was when this was going on. It was before pregnancy, so
Yeah.
it was like I'd say my first 3 years in my 20s.
Yeah. So early 20s.
Because I think it changed after my pregnancy.
Right, that's good.
Yeah.
Okay.
Probably just some anatomical changes.
Yeah, that's good. And so, is there any cardiovascular history in your family at all? Yeah.
I don't know a lot
No.
about my extended family.
That's okay.
What did I write?
Yeah, no, there's nothing that you've mentioned there, so yeah, no,
I don't know.
that's okay. And have you had any anemia or anything
Not
going on?
that's been diagnosed, not that I know.
No, you would have had blood tests along the way. And the varicose veins, anything going on there? Yeah, great. Excellent. And so, from a muscular point of view, have you ever had any cramps?
I get random cramps sometimes.
Yeah.
Actually, I do often get cramps in my upper thigh and
Okay.
butt, I guess. Because when I've had to do my exercises that involve that area, I often can't because I cramp up every time.
Yeah. So it's really when you exercise that you get that.
Yeah, I don't notice it a lot at any other time.
Yeah, okay.
Yeah, any other cramps would be very occasional.
Mm.
Yeah. But that one in particular is, when I'm using that area.
Right.
Yeah.
Uh-huh. And do you get any restless legs at all?
No,
No.
I don't think so.
That's good. You mentioned that when you're anxious, you sometimes get that
Yeah,
tightness.
I
there.
get tension along here and have to click my jaw.
Yeah.
I have a bad neck too that I'm not sure what the problem is, but probably been about 15 years and I have to
Right.
crack my neck on a regular
Ah.
basis, otherwise it gets really tense, like really cricket.
Yeah. And so it feels better after you've done that.
Yeah.
Did you ever hurt your neck?
I don't think so. It kind of came on gradually in my teens,
Okay.
and it only really became a problem. After school when I went to uni, I remember people thought I had like a twitch because I had to keep moving it because it would get uncomfortable.
Yeah.
Mm.
Okay. And just getting back to your TMJ, like the tension that you get there, have you ever ground your teeth at night or been told?
Not
you
that
do?
I'm aware of. I don't know.
No one's ever told you that you
No. I get told I snore. I don't know if you want to put that down on
snore?
respiratory. I do snore.
Mm.
Lucky my husband doesn't have to sleep with me very often at the moment.
Maybe related to that sort of congestion in your nose that you're experiencing as well. Okay. And have you ever pulled a muscle or
Oh yeah.
hurt tendons or yeah?
I did athletics for a long time growing up, like competing on a national level, so
Yeah.
lots of injuries. Did my Achilles a couple of times. I had a torn calf at one point.
Things that come with
Yeah,
that sort of thing.
probably have to check with ACC.
Oh, that's so. What sort of athletics did you do?
I used to do middle distance and
Yeah.
pole vault.
Middle distance and
Pole vault?
pole vault.
Yeah.
Wonderful.
And then of course my back was an issue in my first pregnancy. And then again last year.
Yeah. That's with the side J, is that?
Yeah, well it feels to me muscular, but I've sourced it to the physio last year said it was SIJ dysfunction.
Yeah. Okay. Anything else that you can think of that has happened along the way? No?
Not that I can think of.
No, that's fine. And so colds and flus, do you get those very often?
Yeah, I get a few colds.
Mm. So this year, how many would you have had?
Maybe 2 that were bad.
Yeah.
Other than that, I think, you know, every now and then I get a runny nose and a sore throat, but it doesn't eventuate into much more.
Good. So when you say too bad, how long do they last for, roughly?
3 days.
Yeah, okay. Okay. So you obviously get over them fairly easily.
Yeah, I think so.
Good. That's good. And so flus, do you get flu very much?
I don't know if I've ever had it.
Okay, that's good.
Unless I do and I just think it's a bad cold. I don't know.
Yeah, when you get the colds, like the bad colds, do you get achy?
Yeah, probably have been in the past. Not recently.
Okay, great. Have you had anything like glandular fever or no? Okay, great. And so, and also you mentioned the sinus congestion. So that's more just a blocked nose, was that right? Or
Yes,
congestion in the nose?
I wouldn't say blocked, like it's not like I can't breathe through my nose. It's more just I guess being a little bit stuffy, and it's been chronic, like it's always there. And saying that, I don't feel it at the moment, but I'm off dairy right now, so
that's interesting.
Yeah.
Yeah. And so from a hormonal point of view, a reproductive hormone point of view, so are you menstruating at the moment? Like, are you having your periods at the moment?
Not regularly. I've had 2 this year.
Yeah.
Yeah.
Okay. And what's the prior when you're not, breastfeeding or pregnant? What are your periods like?
I
Generally?
think they were masked for a long time because I was on the ICP. Without it, before I went on it, my first day of my cycle, I would often faint because of the pain and experience. My mum called it a mini labour because I'd have a build up of almost like contractions, and then it would die down again, and then I'd have to sleep it off for a while. And it would only ever happen on my first day.
Yeah.
And that's why the doctors were always a bit like, is it endometriosis or not?
Yeah.
And then being on the pill stopped all of that, so I went without it for years. And then when I came off, I don't get as bad on my first day anymore, but I have a really long cycle, like 35 to 40 days, and it's irregular, and I still experience a reasonable amount of pain and only on the first day.
Okay. Do you need to take anything for the pain when you get it?
Need to, as if
Or do you?
I don't often.
Do you take anything?
I don't often.
No.
Sometimes I might, especially if I don't have the opportunity to rest. But it's also not very often that I think of taking pain relief when I'm uncomfortable anyway.
Yeah. Okay. So if you do, what would you just take Panadol
Yeah,
or something
would be,
like that?
yeah.
So very occasionally. Okay. And so in terms of PMS, do you get? You mentioned you get a bit of bloating and
Yeah.
gas. Anything else?
Increased bowel movements,
Yeah.
probably from the crimping, and just like really severe crimping.
Yeah. And that's so first. Does that start before your period starts? The cramping?
No, it's usually,
Usually-
I might get a little bit the day before, but
Yeah. Okay. Yeah.
to be honest, it's actually probably only hours before.
Right.
Yeah.
Yeah. Okay. Okay. And do you get any, like in terms of PMS, any sore breasts or
No.
acne or
No.
cravings?
Cravings, yes. And I probably get a bit moody.
Yeah. And how long before your period starts did that happen? Just roughly.
So probably only the day before.
Yeah.
And might get a little bit mid-cycle.
Right.
I don't like maybe on a like really mild basis, a little bit of cramping and a little bit of craving. Yeah.
Okay, thanks. So from a nervous system point of view, you mentioned you get the anxiety. So how often do you feel anxious?
Well, I have that agitation all the time,
Yeah.
and a little bit like fluttery in my chest most of the time.
Yeah.
That maybe turns into something a bit more. It's probably only aggravated by, you know, external things. I think at the moment, obviously, I've got a lot going on around me, so
Yes, you've got, yeah.
maybe like a few times, maybe every second day, I might get a little bit too much, and then yeah, feels a bit much.
Yeah.
Which is usually where I use the food to kind of calm things down.
Yeah.
So I've never been able to find anything else that works quite as well, which is obviously not a good habit, but
So I wonder if there's a little bit of
So
blood sugar
calming.
imbalance happening there as well. This combination, I think, of things going on.
yeah.
Okay. And so you've had depression in the past.
Yes,
Yeah.
there's quite a strong family history of depression.
Okay. Great. How's your vision?
Well, I thought it was fine all my life until like a few years ago when I started getting headaches, having to like focus under, you know, like bright lights. And I got my eyes tested and they did give me some glasses. I'm not sure what the prescription was, but it was pretty mild. But I do find it hard to bring things into like really sharp focus on my own. But I don't often wear my glasses unless I'm looking at a screen for a long period of time.
Yeah. So are you still getting headaches?
No. It was like a 3-month period where I was working at computers in a specific room that had fluorescent lights.
Okay.
So obviously there were a few contributors, but that was when I got my eyes tested and they said that there were some mild problems.
Okay. Yeah, so that would be the use of the computer and combination of things probably.
Yeah.
Okay, great. And so smell and taste, any troubles there? What do you think?
No, I don't think so, other than the, you know, congestion in my nose that I've had. But
Does that affect your smell at all, do you think?
yeah, I think sometimes.
Okay. And you haven't noticed anything with your taste at all?
Oh, actually, sometimes I don't get it anymore because I don't eat bread anymore, but when I used to, I would, if I was having too much bread over a period of time, get a funny taste in my mouth.
Okay.
I'm not sure how to describe it. My assumption was it was a flare-up of candida.
Okay. Have you had thrush at all in the past?
Yes.
Yeah. How long ago was that?
Probably had some a long time ago, maybe like in my early 20s, and then with both Jack and Fletcher, I had some on my nipples when feeding.
And so, just looking at the endocrine side of things, I think like what you've told me, I can work out what's going on there. Obviously your blood sugar's sort of out of balance, and I'd say your adrenals are probably really tired and worn out. But we can do a few little tests for that as well. So I'll just transfer some information there. And so from an emotional point of view, how do you feel generally?
It probably depends quite a lot actually. Well, obviously, earlier this year I was struggling for a while. And I probably still have the odd day every now and then when everything is a bit overwhelming.
Yeah.
But I would say it depends on how much sleep I've had the night before as to how I feel emotionally. Yeah.
Yeah. That's understandable.
Yeah, sometimes just really frustrated, like with the kids and not being able to do things that I need to do.
Yeah.
Because of what they need from me, and that's probably what I struggle with the most.
Yeah. Okay, thanks. So what I'm going to do now is ask you to sign a consent, client consent. It's basically giving consent for your health information to be documented, which I've been doing anyway, but also to do any relevant physical examinations. So yes, would you mind just signing there? Thank you, that's great. Just sign it as well. Okay, so do you know what your blood pressure is usually?
No.
Okay, so we'll check that later. And what's your height?
167.
And do you know what your weight is?
About 80, roughly.
Yeah. Great. Do you know what your blood type is?
I think it's O positive, but
I just got a question mark.
yeah,
Yeah, that's fine. And so I'm just going to put your face just from a facial science point of view. It's crumbling. No, yeah. You've got, you don't have that many signs there, which is good. And just there at the top of your lip, is there a little
I think a
pimple? Or,
pimple.
yeah.
It's gone.
You get pimples very often, or?
The odd one occasionally. Not a lot.
Great, that's good. And your nails? Can I have a look at your nails? Thank you. Are they fairly strong?
No.
Can I just feel? Mm. Your hands feel cool.
Yeah.
Do you feel cool often?
My hands and my feet are often cold, but I get really flushed at my face.
Right.
So I
Okay.
might be going now because I feel hot in my face.
Do you ever wake at night feeling hot?
It actually depends. If I'm, if my husband and I are sleeping in the same bed, I'll often get really hot and have to throw the covers off. And if he's not, then I'm really cold and I need extra blankets.
Right. So just generally hot at night, if, and that sort of, if your husband's there? Or just you wake up but sometimes hot?
Yeah, I'd say I wake up hot, but we don't go to bed at the same time, so I think it just takes me a while to warm up.
Yeah. Okay. And so, sorry, can I look at your nails again? I got sidetracked. So you said your nails aren't strong. They actually
No.
feel reasonably strong.
Yeah, I think at the moment, because I'm breastfeeding,
Yeah.
they're better than normal, and in pregnancy too, pretty good.
Okay.
Most of the time they tear and peel a lot.
Right.
Yeah.
Right. So your nail beds are fairly well. But you've got the red margin. Okay, thank you. And can I just have a look at, can I get you to lower your eyelid like that? Thank you. It's slightly pale, it's not too bad. And can I have a look at your tongue? Okay, can you just, can you pop it out a little bit more? No, that's all right, that's fine. Thanks a lot. Okay, so what the tongue is showing is you've got quite a quiver to your tongue, which is actually often related to magnesium being low. It just shows that's involved with anxiety and tension that you're feeling, or the what you described before. So I'd say definitely lower magnesium. So magnesium will be helpful for you to just cope better. And you've got your tongue's slightly red, and you've got quite sort of red and slightly thicker margins down the side, which is the liver gallbladder area.
Okay.
I'd say your liver's slightly out of balance, and you've got a slight yellow coating to your tongue as well. It's just really light coating, but I'd say your liver's a bit out of balance. And I'm not sure how long it's been that way, but certainly it's showing there. What I'll do now is have a look at your irises, if that's all right. Iris brush. Okay. So just look towards my nose. You open your eyes really wide, that's great. I'll just write this down. thank you. Your constitution's generally quite strong, which is really good. Yeah, so you've got nice sort of fine, straight fibres. There's a few signs of stress, which is not surprising to see. One is that your pupils are very small, it didn't open up with the light, which is just related to tension. And also you've got what we call stress rings, which are lines that go around your iris. And again, that's related to, both those things are related to magnesium megalo often. So yeah, I'd say that helping you with magnesium will help you cope with things. You've also got quite a lot of lymphatic congestion, and so have you ever had any problems with your glands at all? Like if you get a cold, do your glands come up?
No, that I've ever
No,
noticed.
actually. And the colour of your iris, when you've got a blue iris, there's a yellowy tone around the centre of your iris, just in the digestive system area, which is indicating that your liver, your kidneys aren't eliminating toxins as efficiently as they might.
Okay.
Not your liver, sorry, your kidneys aren't eliminating toxins as efficiently as they might. So, and you know, that may be perhaps because your liver's out of balance. Hard to say, but both like your lymphatics and your kidneys and your liver are all related to, you know, getting rid of toxins and things from the body. So you're generally quite a strong constitution, which is great. Good. It means that you will get back into balance much faster than someone that's got a poor constitution might. Good. Now, can I do this one? Actually, there's two things I can do here. One is I'd just like to see how your body responds to stress at the moment. So if you could get, just lift your sleeve up a bit. If you could just use your 3 fingers and just scratch along your arm fairly firmly, and just see what happens to that. Okay, so it's come up. So you're getting the red marks. That's after a few seconds, not 5 or 6 seconds. So that's sort of indicating that you're very reactive. Your adrenal system and your sympathetic nervous system is really quite reactive, which is not surprising to see. Yeah, okay, great. Thank you. And the other thing that I'll do is just have another quick look at your eyes and just see whether your pupil's actually reacting to the light. So if I just go like that. Yeah, it's not. It's your pupils are just staying small, which is sometimes they can pulse, but yeah, it's not at the moment. So. Great. There's one other thing that I'd like to do is actually check your blood pressure, but we'll do that I'd like to do the orthostatic blood pressure, so that's checking it lying down after you've been lying down for about 5 minutes, and then checking it when you stand up just to see whether there's, what sort of change there is.
Okay.
So apart from that, I think I don't think we need to do any other assessments. So now I'll just do your zinc taste test as well, just to see what your zinc levels are like. Be interesting to see whether you having taken zinc. Have you done this before?
No.
So what you're doing is pop that in your mouth, just hold it there for 10 to 15 seconds, and then you can either swallow it or spit it back in there. It's up to you. You don't have to swallow it. It's a zinc solution, so it'll just provide zinc, but yeah, whatever you prefer. And then so once you've swallowed it or spat it out, let me know what you've tasted or felt in your mouth.
Okay.
So some people don't taste it, and other people do. So.
For 15 seconds, did you say?
Yeah, about 15 seconds.
It started off quite metallic and then it changed. To a funny taste. I couldn't tell you exactly what the taste is like.
So was it metallic immediately, or was it after a period of time?
Maybe like 2 seconds.
Yeah.
So not straight away, but pretty quickly.
And how long did it stay, that metallic-y taste?
Maybe about 4 or 5 seconds.
Yeah. And then it changed to a different taste.
Yeah.
Yeah, okay.
Something not very palatable.
That's actually quite a good sign. Like that metallic-y taste indicates your zinc's actually reasonably good.
Okay.
Yeah, and you got the taste almost immediately. So I'd say you're probably a 3 to a 4. So right, whereas zinc's useful, you may not need to take zinc every day.
Okay.
So yeah, because your zinc levels are good. That's great, because I don't often see good zinc levels.
Would it be because I'm already taking zinc?
Quite possibly, yeah. You haven't been taking it for long term, have you?
No, so just over a month, maybe 6.
Yeah.
6 to 8 weeks.
So that suggests your zinc levels were good prior to that.
Okay.
They've probably come up a bit since you have been. Great. There's one other thing that I'd like to do is actually check your blood pressure, but we'll do that I'd like to do the orthostatic blood pressure, so that's checking it lying down after you've been lying down for about 5 minutes, and then checking it when you stand up just to see whether there's what sort of change there is.
Okay.
So apart from that, I think don't think we need to do any other assessment. Okay, so I'll just take your pulse. I found it here. And I'll just do is I'll just find your pulse again. Great. You need to find your pulse. Blood pressure now. Thanks. It'll help if I get these. so that was about 110 over 80. Now if I can get you to stand up. Oh yes, so just turn around, you're lying down. Finish. And so what I'm going to do is just take your blood pressure standing up. Oops. Just relax your arm. Okay, so that's quite similar. It's very, very slightly higher, which means that you're, oh, sorry. So that means that you're not as reactive as I had suspected that you might be, because your blood pressure was similar lying and standing. Okay, so thanks for that. So your blood pressure is actually quite good. It's slightly low. It's about 110 over 80, which is actually a healthy level. It's actually healthier to be slightly low. And when you stood, your blood pressure was just very, very slightly higher, which is fine. So your body's not reacting as much as I expected it might be. So it's really good to do that check. And your pulse was reasonably good too. So it was about 17 beats for about a quarter of a minute. So in terms of like what's going on with you, I think there's a couple of things happening. One is what you're eating could be improved a bit. So having a little bit more protein during the day, and a few more vegetables. So just changing the balance of what you're eating a bit, so that you're not as likely to eat sweet things, crave sweet things as much. So we try and help that balance, just to help your blood sugar balance. And also there's quite a few signs that you're low on magnesium. So actually having magnesium will be useful for you to cope and feel better. And you know, it'll help you. You need magnesium for energy and for your adrenals and all sorts of things. So that will be useful. I think we'll probably increase your B vitamin level that you're having. So I'll check that level for that particular supplement you're having, because it is a good one. And also you're showing some stress, slight mild stress, just liver stress. And so there'll be a few things that will have contributed to that, but so we will probably use a homeobotanical to help balance your liver and your adrenals, and just help you to cope better as well. So what I'll do is what I would recommend is before I see you on Friday, which is when I'll give you your treatment plan. What I would suggest would be to try and eat more protein. So you're not having eggs, are you, because of Fletcher? That's fine. Nuts and seeds. You're having chia seeds in your smoothie.
Yes, and sometimes ground flaxseed. And coconut. Other than that, I sometimes have the peanut butter on
the crackers.
And things, but
okay.
I used to eat almonds, but I can't eat almonds at the moment, so.
Okay.
Yeah.
So, but there are, okay, so what nuts, so is it just the almonds that you can't
It's
eat?
just the almonds that we know of. He seems to be fine with peanuts and yeah,
Was
but I
there
haven't
nuts?
tested any other nuts.
Okay.
Yeah.
Okay. So what I would suggest in the meantime is to add, make sure you add flaxseed or LSA or you know, something like that to your smoothie every day.
Yeah.
So that's a fairly.
So I already have, most days have, I can't have LSA because of the almond,
Oh,
but
true.
most days have ground flaxseed. There's a mix
Okay.
that we use that has coconut, flaxseed, something else in it. I can email you with
Yeah,
the
that would be
details
good,
if you
thanks.
like. And most of the time we use that. We've run out of it this week, but I do groceries later in the week, so we can get
Yeah.
some more.
Yeah.
But yeah, most of the time we use that, and I has chia in it.
Yep.
And if not that, then just the chia.
Okay, so the coconut flaxseed mix or the chia. Or,
There's a mix with these three
Oh,
and
okay.
something else.
okay.
And if we don't use that, then we'll just chuck some chia seeds. So this is all ground. Yeah.
Okay. And do you add some vegetables in it sometimes, don't you? Green leafy vegetables?
Sometimes we just have the mango, banana, coconut milk and seed mix, and other times we have a green smoothie, which should have spinach in it.
Okay.
Sometimes spirulina or chlorophyll.
Okay. So, and so other nuts, are you happy to try some other nuts and see what happens?
I would have to include them in the testing that we're already
Sure.
doing.
Yeah.
So at the moment we're about to test him on soy lactate because he's using a soy formula, and we're about to test whether that's
Oh, okay.
an issue or not. So probably couldn't throw some nuts in the mix at the same
Sure,
time.
no, I understand. Okay. So what, I mean, you're eating reasonably well. I think it's just a matter of trying to eat
Yeah.
more regularly without having too much chocolate.
Yeah.
So maybe try and cut down the chocolate a bit and have other snacks in between. So with some sort of protein in it, like so if you're having the crackers with the peanut butter would be fine. So just have whatever you know, that type of thing that you're allowed to eat. And that would include fish and meat and or whatever that you're having at the moment. So, and then if you could let me know what you're having in your what the rest of that mix is, that would be just email me. That would be fantastic. We'll bring it over. And then I'll look at some options for you as well. So fantastic. Thanks for coming in today.
Yeah, no problem.
And I'll see you on Friday.
That's good.
If you've got any questions, between now and then, just ring me. I'm going to be here every day, so ring me or email me, whatever you like, or I can ring you. So,
Good. Sounds good.
great.
Thank you.
Thanks, Jen.